Good afternoon, everyone. Welcome to our webinar this afternoon. I'm Lori Smetanka, Executive Director at the Consumer Voice, and we're delighted to have you here with us today. Our webinar today is how to use the new nursing home affiliation data that has recently been shared by the Centers for Medicare and Medicaid Services. Just a little bit about the Consumer Voice if you're not familiar with our organization. Next slide, please, Libby. We are the leading national voice representing consumers and issues related to long-term care. We work with and on behalf of individuals who live in nursing homes, assisted living facilities, and are receiving long-term care services and supports. And we do our work by advocating for public policies that support quality care and quality of life and is responsive to consumers' needs. We work to empower and educate consumers and families with the knowledge and tools they need to self-advocate. We train and support individuals and groups like advocates and long-term care ombudsmen about how they can better advocate for long-term care and about the issues that residents face. And we also work to promote the critical role of direct care workers and best practices in quality care delivery. Next slide, Libby. So just a few housekeeping rules before we get started. First, you've heard that this program is being recorded, and the link to the recording will be available on the Consumer Voice's website shortly after the webinar. For people who are interested in asking questions, please use the Q&A feature on your control panel to ask questions, and we will get to as many of those as we can at the end of the presentation today. You can use the chat feature to submit comments or to respond to questions or to chat among yourselves. Please do fill out the evaluation questionnaire when the webinar is over. That helps us as we plan webinars and work to make them as responsive to the needs and concerns that you have as best as possible. And we will be linking to resources as appropriate throughout the conversation, or they'll be also available on the Consumer Voice website. So with respect to that, next slide, please, Libby. I introduced myself, Lori Smetanka. Also joining me today is Sam Brooks, who is our Director of Public Policy at the Consumer Voice. And so next slide, please, Libby. So Sam is going to really be leading us through this, but we've been talking about ownership data and transparency for quite a while now, and we know that there is a real relationship between ownership type, between care quality. We know that many owners have, we need to know about owners with respect to also understanding care quality across multiple facilities that they may own. So there are a lot of reasons why we need to have this ownership data. So Sam, tell us what CMS posted and why it is important that we know about it.
Thanks, Lori, and hi, everybody. Excuse me. Well, to CMS's credit and also to President Biden's credit, he announced in February of last year really a great significant set of nursing home reforms that many of you are probably aware of, but some of them focus particularly on ownership and making consumers aware who owns a nursing home. And as Lori said, this serves a couple purposes. First, there is significant evidence, scholarly evidence, that there's a relationship between ownership type and care quality. For instance, a study came out in 2021 showing that nursing homes who are owned or operated by private equity firms, the Medicare residents in those facilities experience a increased mortality rate of 10%. And we also certainly at Consumer Voice have done some work on this, showing how, for instance, nonprofit homes staff at significantly higher levels than for-profit homes on average, almost an hour. But it's also important, not just for that, but as care in nursing homes become consolidated across chains or large owners, it's helpful and very important to know what kind of quality care are chains providing. What kind of quality care is a private owner providing? If you're going to go into a nursing home, what should we expect? And we know that we've often folks often rely on Care Compare, but you only get a small sliver of information. So it was really unavailable, or I guess you could do it, but it was really a significant and kind of a Herculean task to track down who owns a nursing home, and then in turn to understand the type of quality that owners provide. So next slide, please, Libby. So we were really excited on the 28th of June. CMS announced that it would be posting new quality data based on groups of homes with shared ownership or operational control. They issued a QSO, a little memo. The link is there. It's very helpful to go look at. And essentially what CMS did was they assigned affiliate numbers to groups of homes that have shared ownership or control. So a nursing home that shares common ownership with another nursing home will now have a number. And that's very significant, because what that allows CMS to do is to track quality across chains. And frankly, this data comes from what they call PECOS or PECOS, Provider Enrollment Chain and Ownership System, which is infamously hard and inaccurate. As advocates for residents, we often complain, and I'm sure many of you have experienced how hard it is to figure out who owns a home. So CMS really put a lot of effort into it, to their credit. It's not perfect. The data that is in PECOS needs to be correct, and sometimes it isn't. But nevertheless, they've really tried to make this data available to the public. So there are some drawbacks, and we'll talk about that in a second. But in addition to the affiliate number, what they've done is they've aggregated quality data for these affiliate numbers, and that means they've averaged really the care quality in a variety of different measures, including health inspection ratings, staffing, and other performance metrics. So now what you're able to do is you're able to go look at an affiliate number and see, on average, the quality of care that the common owner or operator provides, which is very significant, and I'll show you why. Next step, please. Next slide, please. One thing that we are concerned about is that, and that's why we're having the webinar today, and I'll show you why. It's not readily available. There's an extra step. You have to, while you have the affiliate number, you have to go and download data and be familiar with how to manipulate data in an Excel spreadsheet or other spreadsheet software. So it's not readily available. We've asked CMS to take steps to make this information more available on Care Compare itself. And I'll give an example when we look at it. But for you, we're going to show you how to do it. And hopefully this will be very helpful to you. Next slide. So what we're going to do is we're going to start a Care Compare. Care Compare, for those of you who don't know, is a website maintained by CMS. It provides a variety of measures for different healthcare settings, and these measures vary from staffing levels to facilities that have been flagged for abuse, to a variety of other measures. And it's really the one source for consumers to gauge the type of quality they may receive in a nursing home. It isn't perfect. A lot of the data that goes into the system is self-reported by facilities and prone to inaccuracy, but we work with what we have. So I'm going to lead you through now. Libby, you can stop sharing the screen, and I'm just going to kind of give a tutorial as best I can, so bear with me on how to get to this data. So I'm going to share my screen here, and just one second. And here is where we are. We're at medicare.gov/care-compare, and that was on the previous slide. And once you get here, you have a variety of different healthcare settings, but what we're concerned about are nursing homes, including rehabilitation services. So depending on where you are, you can enter your address in here, and they'll provide a variety of homes in that area. I was looking at some homes in Georgia the other day, so excuse me one second. I'm going to use a zip code from Georgia. And you enter that in. And what comes up here are a number of homes, 11 homes in that area. And you can see the map here, you can see their ratings, and there's a variety of information that's provided on this website. So we're going to go look at the Oaks at Bethany Skilled Nursing. This is in Vidalia, Georgia. I'm not going to take you through all of Care Compare, but essentially on this page is what you're getting is the overall 5-star rating. The 5-star rating is a rating that CMS has devised. It's comprised of a variety of different measures, including how a facility performs on health inspections, how it performs in staffing, and then the quality measures, which are wide ranging. And I'll give you an example of a few. So once you're here, you have your home, you have your ratings, and this new information, which we're focusing on today, is ownership. And it's down here at the bottom. And it tells you here what the legal business name is, what type of nursing home it is. And this information has been here before, and that it's a for-profit limited liability company. This particular home is, excuse me, owned by Pruitt Health. And this is the new information here, and this is what's important. You are getting this affiliate number. So all nursing homes owned or with common ownership or control by Pruitt Health now have this 434 affiliate entity ID. And in an ideal world, we would have the averages here. We would have the information about the other nursing homes commonly owned by Pruitt Health here, but we don't. So what we have to do is we have to go to another page, and we click on here.
Sam, what folks are seeing is a spreadsheet right now.
Oh, I'm sorry. Let me go back. That wasn't good. Hopefully you can see it now.
So we see the Care Compare page that shows penalty. It's saying fire and safety inspections and penalties.
Yeah. Okay. Sorry about that, folks. Let me go back to the beginning. So this is the page that I was referencing. I jumped the gun here a little. And what I said was that the ownership information is down here at the bottom. This is where it tells you who owns the home, Pruitt Health, what type of company it is. It's a for-profit company. And importantly, this new number right here that is the affiliate number. Sorry about that. I didn't realize I was not showing you the page. And what I was saying is, in an ideal world here, we would have the basic information telling you what the performance measures are across the ownership. But we don't have that. We have to go here. This takes us to the data page. CMS maintains a page with all the data that it posts on Care Compare. And this particular page is about the affiliated entity performance measures. And there's a lot of information here. It's not necessarily so easy to use. It gives a description here. But what we want to do is we want to download this data. At least this is how I use it. And when you download it, this will come up. You just want to say download files. You don't have to do anything special here. And it will download into a spreadsheet. And what you need to remember, though, is we need to remember our affiliate ID number. So our affiliate ID number is 434. We want to look and see what's the quality of care provided in other homes by Pruitt Health with the affiliate entity number 434. And this is what you get. You get this spreadsheet. And so this is a long list here of all the affiliate numbers that CMS has accumulated. And the easiest way to probably do this is the affiliate entity ID. And fortunately, in most instances, it goes numerically. So we're going to go down here to maybe one of the easier ways to do it would be to filter. And we can go here and enter 434. And here, hold on one second. That is not what I wanted. One second, please. So this, excuse me, for some reason I had a different number. So the number was actually 429 for Pruitt Health. I apologize. And so here you have it. You have Pruitt Health with their, and you're going to get a variety of information here. And let me isolate this so folks can see it. So this is the information. And again, this is aggregated. There's 86 facilities that are commonly owned by Pruitt Health. And all the information here is the average ratings for these homes. It tells you really a large number of information here. It tells you, for instance, 5 facilities have been cited for abuse. So it tells you that there are facilities in the Pruitt Health chain that have been cited for abuse. But importantly, you get here to the 5-star ratings. The overall 5-star ratings for homes commonly, that's 6 out of 5. The average health inspection rating is 2.7. And then the average staffing rating is 2.3. So these are middle of the road homes. It's telling you this is what generally across the type of care you can expect generally across these homes. And importantly, they have other information here as well. So look here, you have the average total nursing hours per resident day. For us, as you know, minimum staffing is an issue right now. For over 20 years, we've considered 4.1 to be the base. The number is probably higher now, but we've looked at in 2001 CMS released a study that said at the very least that the minimum each nursing home resident needs 4.1 hours of direct care per day to avoid a heightened risk of harm. And that's kind of the number that we have compared other facilities to. 20 years later, that number is probably higher. We'll talk a little bit about the minimum staffing standard in a couple minutes. So if you look here, the average total nursing hours per resident day for homes in the Pruitt Health chain is 3.2, almost an hour lower. So generally they're operating their nursing homes at a level, according to the CMS study, that places nursing home residents at harm. That number drops even further on the weekends to 2.6. Residents don't get healthier on the weekends. Their needs are just the same on the weekends as they are Monday through Friday. Yet they receive almost half an hour less care, over half an hour less care on the weekends. So this gives you really a large look across a chain, and there's all kinds of other information here too. Total amount of fines and dollars that they've been assessed, almost $2 million in fines. Total amount of payment denials. Their facilities have been denied Medicare payment 11 times. And then over here we have a variety of the quality measures we discussed earlier. For instance, you can, the average percentage, let me pick one here that might be helpful. So the average number of residents, these are all measures that are reported, excuse me, by the facility. So they're not necessarily as reliable as other as other measures. So average percentage of long stay high risk residents with pressure ulcers, 10.8%. What makes these hard is here you don't necessarily have the national averages to compare these to, but it does give you an idea of the quality, again, of residents, of the care that you're going to get in a home owned by Pruitt Health. So for instance, look at this last average percentage of healthcare personnel up to date with the COVID vaccine. It's only 26.5%. And the number for residents is 65%. So while this data is great, you have to be able to navigate and manipulate it in this Excel spreadsheet. What we would suggest and what we think it would be important is that these numbers occur on Care Compare. You shouldn't have to have this extra step here to go and download data and look for it. And why can't we have these numbers, the average overall 5-star rating for the affiliate? I think that's going to tell us a lot of information about the care quality in this home. So I went through a lot of information. This has been recorded, and the most important thing is, again, you start a Care Compare, you get that affiliate number, you download this data, and then you're able to look and get a good idea of just the care quality across commonly owned homes. So I'm going to turn it back over to, I'm going to stop here for now.
So before, so a couple questions that have come up,
Sure,
Sam, and
sure.
comments. So as you were talking, some folks were looking on Care Compare at facilities themselves. So, I think a couple points, some folks are noticing that the affiliated entity IDs don't match the names, and actually you had picked 434 that showed for Pruitt on the page, and it was actually wrong on the database. So this data was, I guess there are glitches here. And so that is something that, we need to report back to CMS on for sure, that as we're testing it out, as you're testing it out, there are glitches, there are discrepancies that need to be addressed by CMS. And we will definitely send that information back to them. So that definitely is an issue. I think it is. Could you maybe just kind of do the link walkthrough again? Because I think and slowly, because maybe start at the Care Compare site and just do the link walk for folks again.
Especially since I didn't have the right thing up, and I apologize for that.
There's, I think it is challenging, and again, it
shouldn't be this hard.
It shouldn't be this hard. You shouldn't have to download spreadsheets in order to find this information, and that's part of the point of the need for better transparency, and why we're focused on this. Is you need the information, and you should be able to get it in an easily accessible way.
Sure.
And so there are comments we'll be sending back to CMS, but if you could just kind of walk that through, Sam.
Sure, you should be able to see my screen now. Here we are at the Care Compare. Again, we're entering our area where we want to go. I just used randomly Vidalia, Georgia. You press search, and then you get the homes. We had picked Oaks, and so you click on the Oaks, and now you have kind of the landing page. This is the landing page. It gives you a large amount of information. You want to go down to the bottom to get the ownership information, and that's where it is here. So again, you're getting the name of the facility. And one thing I want to point out is you're absolutely right that the numbers didn't seem to match up, but the name did. So the number, if you have the name, that's another, again, this isn't how it should be, but it's another safeguard to make sure you're looking at the right information. So what I did here is this is where you click open affiliated entity performance information. And that's the link that brings you to this landing page where they're housing all of the data. And I'll walk right through it. What I just do is download it. I think it's the easiest way to do it. For me, at least, you press download and it's going to come up. Latest data is from July 2023. So we're going to download those files. And here it is. And I'll even walk you through it through this. So then we open up our file. Just bear with me a second. And this is what we get. I mean, look at this. It's impossible to really understand. Again, it's hard to use if you don't know Excel. So I'm going to walk it through it like you don't know Excel. I click on this top line. I wrap the text, right? So then what that does is it gives me, it makes it easier to see just where what these categories are. You broaden your, you can slide over here and open this and you see your names better. Another quick trick is if you press, again, it goes slow, Alt WFR, you freeze the top pane. Alt WFR freezes the top pane, so it's always there. So according to CMS, as we talked before, the ownership number, the affiliate number is 434 for Pruitt Health. So let's scroll down here to 434. You're trying to match up this number. And look, just like you said, it doesn't match up. And that's new. This must be new because I hadn't had this problem before. But you know the name is Pruitt Health. It's not Regal Care. And that is how you get the information. Okay. The easiest way to isolate this information, again, is you go up here and you filter. Whoops, hold on. I want to filter up here. And what I can do, what the number is for Pruitt Health is actually 429. So I enter 429 in there. And then you have the one line. It's easier to use. Again, I'm sorry that it's this difficult, but that's why we felt it was necessary to have this webinar today, is that it is hard to use this data. It should be that, one, the data is accurate, and two, at least some of this information, the average overall ratings, the number of facilities with abuse icons, the average staffing should be on Care Compare. It shouldn't be as hard to get to it here. Nevertheless, this is new data that is important. And to CMS's credit, it's going to be helpful to consumers, to researchers, and to other folks who want to see performance across ownership, common ownership. Because remember, they don't all have Pruitt Health on them. They have different names. You can't easily identify common ownership just by the name of the facility. So hopefully once CMS patches this up, makes it a little better, makes it a little more accessible, this is really going to be a valuable tool to residents and their families in making healthcare decisions, and also to researchers. Were there other questions? I'm sorry.
Yeah, I mean, folks, were asking about other ways to slice and dice the information. I mean, you can also search by company name in these
Sure.
in the Excel spreadsheet. So when the spreadsheet comes up, you can search by company name and get it that way. And that will also give you the information across, like what Sam is saying. Folks were asking, is there a way like to get, if you know the company name, can you access all of the facilities that belong to that company? Is there a way to do that? That's something we've been pushing CMS to do, but whether that's available on here.
Yeah, I'm not sure that it is yet. We can look back. The only thing, no, unfortunately, at this point, not with that. I mean, I should say there is another way, and this is broader than what we're talking about today. CMS does maintain ownership data that lists owners for nursing homes. So you could do it that way. I don't know if you want me to show how to do that now, but you're not going to get this aggregated data that we're talking about here. And frankly, when working with ownership data and working with the data that CMS has provided, it's very frustrating because you may know the name of an organization, but the owner is listed as their aunt or their uncle. Um, so I think what CMS has tried to do is to cut through that nebulous kind of relationship and assign a number to the commonly owned homes. And I imagine they're still working on it now. But from this information that I showed you today, they're not going to give you a list of all the nursing homes. There are other ways to do that on the data website, but you'd have to, that's another webinar.
Yeah, and so I mean, I know that folks are interested in seeing, some of the different ways. And again, this is a process that's, kind of moving us forward. The push that's happening for transparency of ownership data and information is something that we all with you have been working on. And it's a way, to continue to push CMS to be putting better ownership information that people can clearly understand, because it does make a difference in terms of care quality across the facilities that are owned by a particular ownership group. It does make a difference when consumers are looking for where they would like to live or where they want their family member to live. You want to go someplace where there is a commitment to high quality care. So let's see. We are going to take some of this back to CMS. There was a question if you all could, how you can advocate with CMS to improve the data. Absolutely. We can make available information about the regional locations in terms of sending information to CMS and where you can send information to them about the challenges you are having with the data. They, definitely we would encourage you to share that with them, because, we want this to be as user-friendly as possible. We want to make it as available as possible. There was a question about the time frames covered in the star ratings. Sam, are you able to answer that question?
I think it's 3 years, 2 or 3 years. That I mean, that's what goes into the care compared data. So it's averaging that.
Right.
Right.
That's right. It's 3 years, kind of three cycles, three
Yeah,
survey cycles
exactly.
that feeds into that information. So I'm trying to look at some of the questions.
Yeah, I think I just wanted to point out, there's some questions about how do we figure out who owns it? And as you mentioned, earlier this year, CMS had issued a notice of proposed rulemaking regarding better ownership transparency, including identifying owners that are private equity and other ownership types. And we submitted comments on that because we felt like they weren't robust enough. They wouldn't capture enough folks. And I think what we need is, as you said, more transparency to make sure that everyone here is captured. Because at this point, it doesn't say private equity, right? It doesn't say this home is private equity. You have to know the name of the private equity firm. And there's layers upon layers of ownership here that can really hide who owns the home. But what you're getting here is, I think what CMS has done, or what they have claimed to have done, is try to cut through that and associate homes that they can with the same affiliate number, and therefore give you performance quality across those numbers. It's not going to be perfect, right? This certainly isn't going to be about getting down into the weeds of the multi-layers of ownership, but what it's going to do is give you an idea of performance across the various homes.
Well, and certainly as you're advocating across homes, if you know that there are issues in a facility and they own multiple facilities in your town, in your community, in your state, you can also be focused in your advocacy in terms of how that works too, and looking at the ratings for the facilities that are owned by different entities. Take your advocacy to the regional and the corporate levels. If there are real issues with quality there and it goes across the board. We know that the ownership information is being used also by different agencies as they are looking at holding facilities accountable, like through Medicaid fraud control units, for example, and Department of Justice cases. They also are using information to kind of look across facilities, but consumers need this information as well, and surveyors, we think, should be using it also.
Yeah, I just want to say, Toby did point out that, Toby Edelman pointed out that on the data webpage, you can just press view data. Let me show folks just so I'm not being abstract here. You can press view data here rather than downloading the information, and enter your number, whatever, and then the nursing home comes home. Obviously, it's not Regal Care. Reason I like this, but it doesn't all show up on one page. But it can be helpful. So if you look, you can scroll through and you don't have to download all the information. And this might be easier, as Toby pointed out, to do that. You just, you have to scroll from side to side. I like the spreadsheet just because it's much easier to look at, but this might be more helpful to folks who don't want to download a clunky spreadsheet and deal with all of that. It's just you have to scroll through it like this.
Mm-hmm. So in the chat, we've put the email address that was listed in the memo that CMS sent out announcing this new information being available through the Care Compare website. And so if you do find discrepancies in numbers or in data or information, we would suggest you send them an email at that address. So we know this is complicated. That's why Sam wanted to walk through it with all of you today, as we're able to work with CMS, and as new information comes out, we'll continue to share that as well. And as hopefully as possible, if we are able, and we'll continue to look at, are there ways to provide you more information, and maybe we do need to do another webinar, Sam, on that other way of gathering information that you mentioned, that folks can drill down into. I know there was some interest in that from some of the folks that were commenting on today. So with that, we wanted to thank you for being part of this part of the webinar today. We also wanted to let you know that we've been also working on the staffing issue with respect to trying to really focus on and encourage the adoption of a minimum staffing standard in long-term care facilities. We know that CMS is supposed to be releasing a notice of proposed rulemaking to set a minimum standard in nursing homes. We thought it would be out by now. All indications had been, we were told spring. That's been delayed. We've now been told August or early fall. We're trying to get more clarity on that, but we still need to keep up the pressure to encourage CMS to put out a proposed rule that would require a strong standard for staffing in nursing homes. And we define that based on research evidence as a minimum of 4.1 hours per resident per day. So we have released today, as Congress is going into their August recess, they're all going to be back in your home districts for the month of August. Some of them will be holding town hall meetings or looking to engage with you in different ways through your local offices. There are still going to be some staff that are available in their congressional offices in Washington, D.C., but we would strongly encourage you to connect with your Congress people as they are back home or in their offices. And we released this morning an action alert encouraging you to reach out to them. You can send them a message yourself. There are some talking points in the action alert that went out, or you could use the embedded message that is there. You just need to click on the information and put in your contact information, and it will send a letter for you right to your member of Congress. But this is something that, despite the fact that CMS is the one releasing this notice of proposed rulemaking, members of Congress are actively involved in this process right now. There are lots of letters and phone calls and conversations happening between CMS and Congress and lots of other agencies. But consumers need to be sending the message that we demand a strong staffing standard in nursing homes in order to ensure that residents are getting the care and services that they need and to protect them from harm. That has to be in place, and we need it to be put into place, and we need it to be enforced. So please take a moment to contact your member of Congress and keep up the pressure to encourage them to support a strong standard. With that, we're going to close for this afternoon. Thanks so much for joining. Thanks, Sam, for walking us through the information. We will post the recording and the slides to the Consumer Voices website. The action alert is available on our website as well. And we will look forward to connecting with you all in the near future. So thanks so much. Thanks for being with us today.